Good evening and welcome. Welcome everyone and thank you for joining us. My name is Nachiappan. I'm Professor of Clinical Biomechanics here at Staffordshire University. I'll shortly introduce our panel this evening, but before I do that, just to clarify some of the housekeeping arrangements. We'll have a number of presentations just to introduce the topic and to set the scene, followed by around 25 minutes of discussion, question and answers. So it'll be great if you could type in your answers on the question answer session of the box on the right hand side of the screen. It's strange to do this. It's easier to do it on a lecture theatre, face to face. That's what we would have really loved to do. But here we are. This session is being recorded and it will be available to watch again. So the details would be circulated after the event. I'm really delighted to be asked to facilitate this conversation titled Access, How Far We Have Come, How Far We Still Have to Go. And I'd really be happy to talk about some of the stuff that we do here in staffs that we can wait for a minute. But before that, I'd like to extend a real warm welcome, our Staffordshire University welcome to our panel. Atif Choudhury, good friend of mine, and we're starting to do work together on various aspects. We've got fantastic Deol and Mo Ahmed, and also Portia would be on the panel, would be presenting in a bit, and would be on the panel. Now, just to give a bit of introduction before I invite Atif, UK Disability History Month runs from 18th November, that's today, to 18th of December. There's various events happening, and if you see the social media channels and hashtag Disability History Month, there's been few things which has been posted today. And this is the 11th year, and in this 11th year, we are focusing on access and asking questions as to how far we have come and how far we still have to go. This particular year is especially important because it's also the 10th anniversary of the Equality Act. So it's appropriate that we are reflecting on how far we have come since that particular event in improving access for people with disability. For access, for disabled people access, it's now become a fundamental human right and is gaining participation on equal level with others. In that sense, it's very, very important that we are having this discussion, and it's still it's important to note that disabled people have struggled for many years to change the society's physical and information environment. It's particularly relevant when we're talking about the university context in terms of information environment. We will, this evening in the short session, we will consider the impact of assistive technology as a necessity for all, not an adaptation for a few. That's one of the things that we as a group, we as a university are looking at, and I'll talk about that later this evening. We'll hear from some of our students and also who are on the panel today, and particularly reflecting on how far we have come in higher education with support for disabled students. I'm going to stop there with no further ado. I'm going to introduce our first speaker, Atif. Atif Choudhury is the Chief Executive of Diversity and Ability, an award-winning disability-led social enterprise which supports students, organizations, and social justice. They have several projects, and as I mentioned very briefly, we are starting to work together. I'm really glad that Atif agreed to talk at this event. I'm not going to read his CV or his organization's achievements, but I'll give enough time for him to share his thoughts and ideas with us to set the scene. Over to you, Atif.
Thank you, Nachi, and thank you everybody for being here today and making the time and being part of such a good occasion in terms of the celebration of not just the 10 years of the Equalities Act, but also the 25 years of the Disability Discrimination Act. So there's lots to think about in terms of how far we have come as an organisation, how far we've come as a culture within this country, and of course the global responsibility that we have as a nation to make sure that we're pioneering these ideas and that they are relevant and really felt. I'm going to start just sort of running the presentation, if I may, Nachi, in the background, and then just sort of take us all on a bit of a journey. Primarily, what diversity and ability does, and it's very well known for, is to provide assistive technology training. Our success of this has been about employing the very lived experiences of people that have needed to access technology and needed to access support, and often found that the assistive technology they're using has been life-changing. And likewise, they've also found that the assistive technology they're using hasn't been good enough, and discovered and developed and created new ways to make sure that that technology was meaningful, that could be used. Ultimately, when we look about how far things we've travelled and the journey of assistive technology and accessibility, we're also there to look at, fundamentally, to understand that what is it that makes it work? Is it really about technology, and can technology be this silver bullet that can make things so much easier for people? And in which case, is it just a case of moving forwards and making sure that technology is better? I would say that that's probably one way of looking at it. It would be the one that I'd worry about, though, if we did see it that way. And in fact, I'd be much more interested in finding out what is it that makes this technology be understood in terms of tools, and whether or not people are able to access these tools. And what is it about the human lived experience that people have brought to this to say, actually, this is not about technology, this is about strategies and how that technology supports those strategies. This is about making sure that we have a human-centered solution to address a human-centered need. And when we are talking about that, how do we make sure that we're involving the very people in this technology and in this space? The very people that need it most are often the very people that can access it the least. And these are really profound elements about when we talk about access and the celebration of Disability History Month, and we talk about the realities of how far have we actually come? Have we come far enough? Are we living in a bubble that says, well, this is a UK model, and in the UK we have the Equalities Act, it's very progressive, but that's not how the world is working on, and the world is not the UK. And the world is made up of communities and lived experiences and assets that we will never get to hear about, because they themselves are facing not just physical disablement or hidden differences, but they're facing social economic barriers, social barriers, attitudinal barriers. And these are preventing them ever accessing any kind of technology. And it will largely be about cost, but it will also be about conversations, about the kind of conversations that says, here's a grant and here's a fund, and here's where you can apply for things to get them free. So to remedy that, we've got to talk about what social barriers are truly there, and not put that in the space of just saying whether it's good technology or not, but rather, how is that technology meaningful to a person's life? And what strategy has made it work? And who got to deliver the support? I would strongly argue, perhaps cynically, but I would strongly argue that for a lot of people, it's being able to see such technology being used in action, and certainly when it's taught and delivered by people with shared experiences, that you can see that that technology really matters. So how far have we come? Well, we've come a long way. The DDA says that. It saddens me that 25 years ago we didn't have one, that it wasn't illegal to discriminate on the grounds of discrimination and disability, but it's here. The Equalities Act, it asks us to anticipate. We have a real opportunity to anticipate what social barriers are there. And so I'll move on to the next slide, if I may, and think, right, so how do we take us on a speedy journey that is not too speedy, but certainly meaningful? So for me, diversity is about counting people. Of course it is. But inclusion is about insisting people count. And there is a key difference between that. It's about looking at the social barriers and the class barriers that prevent people being able to have agency and voice. It's not enough that we're just brown or that we're disabled, but rather what class do we come from? What space do we come from to participate? So on to the next slide. I will just ask this question. Some of you may be familiar with some of these people and some of you may not. I'm sure in the chat as you're watching this that there's lots that you might want to say about one or two of the figures. I would ask you questions. What do these images have in common, if at all? If people feel free to chat and write in the chat room to say what they think they can see, I would strongly welcome that, especially for those who are recording it and watching it afterwards. The image that's in the corner on the left hand side, I wonder, the black and white picture, I wonder if people are familiar with what that image might be. The image underneath it looks a little bit strange, antique, but very, very important to us all. The two men in the middle are famous for a number of reasons. And then we've got the two images and the lady at the bottom and the lady at the top. If I ask, what do these images have in common? The answer is simple. They're all led by people who've had marginalized experiences in their lives. They're all led by people and created by people who have experienced disablement. If I think about Thomas Edison and his invention of the light bulb that you can see, here's a diabetic deaf man being able to create something that could truly change the world. In a world full of candles, who really recognized that we needed it? Frida Kahlo is very famous for a painting. Very few people know that she had polio and that her spine was really in a serious car accident, and yet she was able to do incredible work, but not recognized for a painting when she was younger. And of course, we're becoming more familiar with Greta Thunberg and her ability to use her superpower, as she called it, autism, her superpower, which could change the thinking in the Northern Hemisphere. If I move on to the next slide, actually, I will say this as well. The black and white picture, before I forget, that's Alan Turing's machine. Alan Turing created a machine that allowed us to break the German war machine called Enigma. His machine was called Christopher. But I guess the question is, what do we think about first? Do we think about people as leaders in their fields, or about a disabled person? Does it even matter? These are questions we need to ask ourselves in order to make sure that other people can participate and have agency and recognize, actually, such lived experiences have truly changed the world we live in. So why do we not talk about them enough? And why do we not recognize that disabled people are building not just innovation, but also the diversity of thought? And that diversity of thought is the very thing that we need to see us through difficult changes. Next slide for me, Matthew. So I touched on this earlier with the 1995 Disability Discrimination Act. And if we think about how far we have come, in 1992 we built the Disabled Living Allowance. The idea, and it wasn't that long ago, for some of you remember that, but in 1992 there was a special fund and allowing disabled people to live independently. To imagine in the 80s and 70s that this wasn't a reality for people, that people had to live in housing and to not live independently. I'm glad that we've gone past those days. We think about 2010, the UN-CRPD Accords, and the timing of that. And the UK ratified the United Nations Centre of Accords for People with Disabilities. And we think about where we are today. And are we far enough today? It's great that we're having these kind of conversations to look at the role we play. We're also facing, and sadly, a global crisis that's going to see more marginalised experiences come to fruition. We're going to see more and more experiences perhaps pushed aside because of the emergencies around the pandemic that we're facing. And we have a responsibility to recognise that people will all deserve to survive through this space and to flourish through this space. But can we lean in and do we say, okay, well, look, we did really good things in the past, but those were the past and they were difficult times and we got through them. But now we're facing a real crisis, so we have to be a bit more careful and we don't spend the money that we would have done in the past. Or do we actually recognise that lived experiences create the very innovations that make us get through crisis. They get us through changes. These are real challenges, but they need to be on the table, and we need to be able to make sure that assistive technology plays a role in providing that equality and that equity. Next slide for me, Nachi, if you would. And I'm going to show an image that I hope some of you are familiar with, and I will sort of bring it to a close. But just for the next 2 slides, I want to just share something. Okay? So here we are today. We're embracing a social model. I very much would like this opportunity to get more people excited about the social model and think of it not as a model anymore, but a value that really says this is about individualized support and addressing individualized needs. Of course, there are protected characteristics, and of course, we're here to talk about them. But we also have to look at a social model that says, what are the individualized needs and the aspirations of the person in the room? And what are the social barriers preventing them being able to fully participate in their aspirations and our collective needs? A medical model doesn't do that. I won't spend too much time elaborating on that for the moment, but a medical model really puts the problematization on the person. And we've seen pioneering movements over the last 25 years since the DDA to challenge that. So we really can't go backwards or even be part of something that allows us to creep backwards. So a pioneering, and I hope a positive thought, I'm going to send you for the next slide. And some of you may be familiar with this. If not, this is the image of the 17 UN 2030 Sustainability Development Goals. I really ask everyone to have a look at these and look at the role that it plays in their workplace and in the country they live in, and the relationships and the friendships that they have globally. What I really love about the 17 goals, the UN Sustainable Development Goals, are they don't specifically name disability at all. Not one of them does. So then the challenge could be, well, hang on, so are we forgetting about disabled people? Are we ignoring that then? We don't have a goal for disabled people? I think that's one way of looking at it, but I like to think, and I'm pretty confident in this, that that would be wrong. Being a person working quite closely now with Nachi, as he's mentioned, and working with communities in the global south, I get to see these UN SDG goals talked about more, and I get to see how disability is infused all the way through. Now, that does not mean that we should be complacent, and it doesn't mean that this is just all wonderful and woolly, but it means that it's accountable. It means that we can actually say, look, we have no business talking about equality or social economic change if we're not including the lives of disabled people. We have no business talking about gender equality and how that changes or can be improved unless we're talking about the marginalized experiences of disabled people in that story. It goes on, and to be able to do that, to ensure, look, disabled people are more likely to be on the end of poverty, and therefore, how can we talk about poverty without including the assets of those lived experiences? I'm going to leave you on the next slide, which is specifically five of the SDG goals that I've singled out. There are others, and I think that's the responsibility for the audience to see, actually, yeah, of these five goals are explicit about the SDG goals, and more importantly, they're explicit about how disabled lives are impacted and strengthened through this. But I would say, look at the other 12. Make it your challenge to see how disabled experiences are motivated and included in those other 12. And recognise that it doesn't get to be part of an experience that doesn't inform our process. In essence, if we think about how far we've come and how far we've got to go, it's about access, which is the theme of this year's Disability History Month. Nachi, would you go to the next slide for me? And in that space, yes, we're here to talk about access, but how do we truly talk about access unless we talk about impact? And we've got to talk about, and going back to the first part of what I said was, how do we get more people addressing their own experiences and their own needs to access things better and what they've accessed well, unless we're prepared to embrace the fact that disablement affects people differently. Impact is everything. So I guess I would like to envisage how far we go as a future and building a presence that says, I'm not here to talk about disabled people. I'm here to talk about disablement and how we challenge that. Thank you so much, everyone, for listening. And there's some contact details there and some space for questions, really, as we go through this presentation and the rest of the panel. Thank you.
Okay, following that fantastic presentation from Atif, and before we listen to some of the experiences from Bal and Mo, I thought it'll be good to tell you why I'm here and what research we do here at Staffordshire University in this particular area. Whilst we can talk about various pedagogical research and also within our computing school and other areas of health and social care and our education, here at the Center for Biomechanics and Rehabilitation Technologies, our work focuses on improving health, quality of life, and healthcare provision by solving complex biomechanical issues relating to diseases that are of public health concern. We aim to advance the understanding of musculoskeletal biomechanics through highly innovative and integrated approaches. Now, Atif mentioned Sustainable Development Goals. Within our center, we look at particularly focused on Sdg Goal 3, which looks at non-communicable diseases and also achieve universal health coverage. Now, I'm not going to expand on all our work related to this particular SDG, but I'm going to focus more on assistive technology and the stuff that which is of relevance this evening. Within assistive technology, according to WHO, it has been themed into various areas. Our focus on AT, on our research, focuses mainly in the area of mobility. As you see in the picture, there are several areas of AT, and mobility is one of the several subgroupings. Assistive technology is an umbrella term covering various systems and services related to the delivery of assistive products and services. Again, as Atif mentioned, we work on areas to help improve these things in the global south. Having said that, even in the developed nations, there are various issues that we need to deal with. Globally, at the moment, more than 1 billion people need one or more assistive products to help them with their activities of daily living. And that's what we focus on. And one of the main things that we do here at Staffordshire University within our own research center is focus on diabetic foot, amputations relating to diabetes, and various areas relating to the design of insoles, how to help people to avoid amputations and needing this assistive technology. My colleague Eve and I have completed several systematic reviews in this area, which focuses on various things. One of the substantive pieces of work that we did, which supports the WHO standards for prosthetics and orthotics that you could see up on screen. So we hope that these standards help, and it advocates the integration of prosthetics and orthotic services into mainstream health services under universal health coverage. We're proud to have contributed to this, and we continue to work in this area. These standards, as part of the GATE initiative within WHO, this was established in 2014 to improve the access to high quality, affordable assistive technology and assistive products to everyone, everywhere. So it focuses on 5 Ps: people, personnel, provision, products, and policy. Within Staffordshire University, we focus on all of these 5 Ps in various projects at the moment. So if people are interested in knowing more about our work, you could visit our website and look at various projects that we are involved with in this space. As I mentioned, our work at Staffs includes numerous projects in a diverse range of assistive products, from diabetic footwear to post-operative footwear to orthoses to lower limb prostheses to crutches, wheelchairs, and spinal braces. One of the novel projects that we are involved with now is to look at trade barriers in the provision of assistive products, and we are focusing on various African countries at the moment, but we hope to expand that to other areas. And the other important and a landmark piece of work that we have done here at Staffordshire is to focus on the orthotic services in the UK. So we have mapped where these services are lacking. And what we have found, our report, which is published in BMJ earlier this year, looks at the type of orthotic services, the waiting time to get these products and all that kind of stuff. So our results showed that it was a postcode lottery, even in an advanced country where it's free at the point of the point of care. In that sense, we have a lot more to do, and we have got a long way to go. So the work continues in that space. So before I finish, I won't take a lot of time. I want to give enough time for our discussion this evening. So what I want to look at before I finish is I want to highlight something else that we are involved with. So when WHO provided this assistive products list, they came up with 50 lists, which 50 products in that list, which I've shown on the screen. Now, WHO then encouraged all of the countries to develop their own list, which would suit to their culture and to their country requirements. And I'm proud to say UK is the first European country to develop or to embark on a journey to develop this particular list. And we are proud to be part of that journey. And at the moment, the UK assistive products list survey is on. And people who are listening this evening, if you think that you're using a particular product which needs to be on the list, please complete that survey. The link is provided on the screen. Use that, or you could use BATA APL survey on any search engine, and you'll end up in that particular page. And please include the product that you have, and we'll make sure that that's included in the UK context. So I'm not going to go on. I'm going to stop there. And here are my details in terms of how to contact us and to get more information on the work that we do here at Staffordshire. Now, we will now continue the conversation and we'll hear now from our representatives from our student body, Disabled Students Network here at Staffordshire University. We've got fantastic Deol and Mohammed. Bal is a student here at Staffs, and she's also chair of our network. And Mo is one of the members, one of the active members of the network. We'll also hear from Portia Bentley, our equality coordinator here at Staffs, who set the scene of how far we have come and where to go. And then we will have a discussion and looking forward to your questions. So, Bal, over to you.
Thank you. So, hi everyone, can you hear me? Yeah, great. So being a student is hard. However, personally for me, I think being a disabled student is harder. Yeah, but you have to make adaptations to your everyday life, where possible, to fit in with external factors that are going on around you. For example, being a wheelchair user myself, I have to find .co and plan my routes efficiently to get to a meeting or to get to a lecture on time. I can't cross the road at a random pavement part because there's no .co there. Also, having to ask canteen staff to describe the food on campus isn't great, but hopefully with the new building, the counters will be accessible, so that'll be great. COVID-19 impacted on my mental health because I had to shield significantly for 16 weeks. I did not leave my house. Finding the best online format to continue working on my PhD with my support worker was challenging, but in the end we found using Microsoft Teams was the best route because you could share our screens and I could see what he was typing. But in the end, it was ultimately worth the effort because I passed my first year, so that was good news. But it also impacted negatively a lot of other people. But I'll let Portia chat about that a bit more. But one of the positives that has come from COVID-19 is that app providers have now had to make things more accessible. So a lot of apps now have screen readers because I've also got a visual impairment too. And internet providers have had to increase their broadband width, which is great. So apps and Wi-Fi can run more smoothly. Face masks mean I can't read people's face. It makes it harder to see people's reactions to what you say or do. But that's the same for everyone. Unfortunately, we're in the middle of a pandemic, but that is one of the things that I find challenging. And people expect to receive answers from Teams meetings instantly, and nobody is sure who is on campus, as staff have rolling notices, making it hard to know if they are on campus or if they are on leave or working from home. So yeah, that's it from me. Over to you, Mo. Thank you.
Thank you.
Thank you.
Hi everyone. Hello on this evening. So I just want to start off by just quickly talking generally about disability and just around this idea of categorizing someone as either having a disability or not. And hopefully what I'm about to discuss will kind of show that it's not that simple. So there are many different impairments, so visual, cognitive, physical, hearing impairments, and within those impairments there are different disabilities which differ from one disability to another, and these disabilities can affect people in different ways, even if someone has the same disability. So this is why disability should be viewed more as a spectrum rather than just simply aesthetic kind of having disability or not. So my impairment is visual impairment, and my specific disability is a condition called Leber's congenital amaurosis. So some of the barriers and experiences I'm going to be discussing really quickly are maybe similar to other people's, but may also be completely different, even if someone has exactly the same eye condition as me. So my vision means that I can only see shapes and figures, but not the finer details of these objects. So this means that my lack of vision, I can't read bus and train timetables, I can't read writing on signs or on packaging or on lecture screens, or for example when signing class registers. My lack of vision means that I can't recognize people or color by sight, or even recognize that someone is making eye contact with me. So academically, this can be quite limiting in certain aspects, especially when trying to understand what lecturers are referring to on the screen. Lecturers often use subtle gestures to kind of indicate what they are referring to. So whether this be pointing at the screen or saying, as you can see on the screen, which obviously are something that I'm unable to do. So that's quite limiting sometimes. Although there are definitely ways around this in terms of lectures being made aware and just being more descriptive throughout the sessions. So my lack of vision also means, in terms of education, that it can be quite difficult to form groups around class discussions, because this includes making eye contact with people, being able to spot familiar people from across the room, and again, this is something I can't do. But there are definitely some things that I am very grateful for and that help me live an independent life and overcome some of these barriers. So one of these things is my guide dog, Frida. So Frida helps me locate empty seats, navigate around obstacles, find a set of stairs. She'll help me find crossings when walking down the road, and even the button at Pelican crossings. But unfortunately, there are some things that Frida is not trained to do, and that COVID-19 has definitely posed some further barriers that she is just simply not trained to help me overcome. So this includes social distancing, following one-way systems, helping me navigate the many perspex screens that have been erected around many public buildings. So these are just things that she's not simply trained to do. Social distancing has meant that it's quite difficult sometimes to gain help from people, understandably due to maintaining that 2-meter distance. But for me personally, that can be quite, that can impact on me quite a lot, because I need that kind of direction to a specific object rather than the general area of it. Also, in terms of academically, COVID-19 has also had some other impacts, such as due to courses moving online, certain platforms are now being used, which is quite inaccessible sometimes. So I use an assistive technology called JAWS, which is a text-to-speech software. So it reads what's on the screen and then it translates it out loud into verbal communication. But this software isn't accessible with a lot of programs. So one feature that I'm unable to use is the chat feature on Blackboard. So this means that I'm unable to interact with fellow students, I'm unable to ask questions to my lecturers, which can be quite limiting at the time. Also, these online sessions could have meant that there could have been a detrimental impact on my learning, but the university has helped me overcome this barrier. So in terms of online learning, I would have been missing out on the visual information that's on the screen, so pictures, graphs, tables, which I would not have been missing out on face-to-face learning. However, the university, in overcoming this barrier, have ensured that I've had a room available when I have these lectures and seminars, so that I'm able to attend this room with my note taker, who verbally describes this information. So just on the stuff that I've talked about, the barriers and experiences that I've had, although they may be similar to some other vision impaired people, they definitely can be and will be different to other people. And this is why we should definitely think of disability as a spectrum rather than a single entity. And that's all from me. Thank you everyone for listening.
Thank you very much, Mo, and thank you, Belle. As you've heard, my name's Portia Bentley and I'm the Equality Coordinator and I work in student support and wellbeing. And there's a couple of things I just wanted to mention briefly because I know time is running away with us. But I've been at Staffordshire University now for 11 years in some capacity related to equality and inclusion. And certainly I've seen quite a few differences over those 11 years. When I first started at university, I worked as a disability coordinator in arts, media and design. And the reason why I was put into post was because these academic staff were worried about how to put into place reasonable adjustments for students. Over time, in that role, certainly people became more accepting that actually, you know, this was a good thing to do, and it wasn't difficult. A lot of the time, very small adjustments make a huge difference to individuals. Even something as simple as describing, as Mo was saying, about describing something on the screen to make a huge impact. Fast forward 11 years and COVID has thrown at us a whole new raft of barriers. But I think certainly from students and staff that I've spoken to, the isolation has been one of the biggest issues. And if you think, you know, you've got impaired mobility, mental health issues, you know, even things like diabetes that mean you have to shield or whatever, that means that you've become more isolated from society and perhaps feel as if things are going backwards, not forwards. So I suppose I'd end by saying, you know, be kind to people, and we are moving forward, but we need to do more yet. And that's it from me.
Thank you, Portia.
Thanks, Portia. Thank you, Paul and Mo. I think now we've got enough time for questions. In case if the conversation continues, we can go beyond 7 a wee bit in case if we need it. And again, I'd like to really thank Bal and Mo in terms of highlighting some of the issues that they faced and how they've overcome that. And one of the things again I'd say is things like text-to-speech software is one aspect of it. Wheelchairs and mobility assisted devices, and so it's about assistive products. And again, Portia rightly said in terms of that small reasonable adjustments, how much difference that makes, and that's very, very important. So let me start off with I know there are some questions coming up on the screen, but before that, one of the things that I want to pose is how EAT may assist in addressing some of these challenges. Say we do have various types of technology. We have all these smartphones and various types of technological advancements in mobility assistive devices and all that. But generally, as assistive technology, how does these assist from your experience, Portia? In terms of you've been working with these different types of technologies, and as you would have seen 11 years ago, we didn't have things like WhatsApp to get in touch with the students. Now we do have it. So you've seen those technological changes, and so if you could kind of give your initial comments, then we'll move to Atif to get his observations.
Absolutely. I think assistive technology has helped in many ways. But I think as an able-bodied person using those technologies, I'm not always aware of the barriers. So, for example, Mo mentioned, that certain software and apps and online teaching, great in many, many respects, but there are bits that mean it makes it just as challenging for him as it does in his day-to-day life. So, for example, he still can't see the screen, he can't use the chat function. So I can imagine that must be quite isolating when you've got a really pertinent point you want to make and you can't put it in the chat box, and you can't necessarily see to put your hand up on the screen. So what do you do in that circumstance? And probably by the time you've worked that out, the topic's moved on somewhere else. That's not to diminish, all the good work that is going on. We've certainly seen during COVID, Teams has updated, I don't know how many times, with different features. And I'm sure it's the same for other apps that are available. I sound like an advert there for Microsoft, didn't I? Didn't mean to.
That actually also that's happened to me because of my vision impairment. I really wanted to make a point. By the time I found that the raise your hand button, the conversation had moved on to the next agenda item. So, and I can't write it down on a piece of paper, but I can't see. So my thought has to be drifted up into space. It's really frustrating, but
I will say, perhaps on a positive though, certainly in terms of people perhaps who are experiencing mental health issues, that the social media, WhatsApp and so on and so forth perhaps can break down those barriers of feeling isolated.
Yeah.
Because I've had many conversations with people. What if we've had this pandemic sort of 30 years ago? People would have been locked in their homes with no contact with anybody.
Absolutely.
Had it not been for WhatsApp, and I mean, I've never spoken to my mum as much as I have during the pandemic. That's not a bad thing, by the way. My mum's lovely, but because we couldn't see each other, there was a video call every night, and I think from that aspect, in terms of mental well-being, it's been fantastic.
Yeah, thanks, Paul and Portia for that. Atif, if I can come to you, one of the things that we have discussed is the cultural component to this, and particularly your international work in this space is important. And you're the best person to kind of compare some of these support that we have here in the UK compared to other places.
Yeah, thank you, Natalie. You've been very generous. Thank you. Yeah, look, I mean, I think I'll sort of punctuate the point, I guess, is that more often than not, we should be talking about disablement rather than the context of the disabled people. What I mean by that is not to brush over disabled experienced lives, but actually to say, look, and as Mo touched on when we talked about spectrums, I'm very interested in that as a narrative. I'm particularly, and I guess when they think about this year's theme, it's access, but I'm wanting to talk about impact. And I talk about this a lot. What is the impact of the disability and the disablement? And so when we think about assistive technology, it's very important that we say, look, this is exciting, especially when it's driven by lived experiences. But we also have to talk about how hard was it to access it and what impact did it make? Sometimes we say, look, this is all the bells and buttons it does, and look what it's done for this person. Technology has an interesting dynamic because it's something that excites people. It's a bit marmitey. It can excite a lot of people and intimidate a lot of others. So I sometimes feel like, how do we get the idea that it's a tool? And it's no different to the tool that, that Portia and I and Nachi, you are wearing on your head right now. We don't need a special door. We don't walk through a special place. We don't have lots of people running around to say, are we okay? Because we've got to, and it doesn't say anything about our money. But 200 years ago, it would have done. It says we're rich as well as short-sighted. So I guess the question is for technology, and this is the best technology I've ever had in my life, is how do we make sure that this technology, if it's a useful tool, if it can do so much, can be made accessible to more? And that's really the future challenge lies in that. I think screen readers incredible, text-to-speech incredible, voice input technology incredible. I could go on, and but I think that we've got to say is, can we, when make these evaluations and we measure the access and the impact, can we do it really well? And most importantly, can we do it without tokenizing lived experiences? But can we employ and create equity and jobs for disabled people to actually use their lived experiences to show what this technology didn't do well enough, and yet they got through it? I hope that makes sense.
Yeah. Thanks for that, Atif. Definitely, it makes sense. One of the things is, again, you rightly highlighted lived experiences. My colleague Eve has spent 3 weeks in India looking at the lived experiences of people and their needs in terms of mobility assistive technology. She kind of interviewed both the patients and also the clinicians who are providing these assistive technology. That opens up quite a lot of new avenues. It's not about what sensors we use or what new software we use or what new technology we have. It is about the need, and you put the person in the middle of all this, and that's what you're talking about. That leads nicely on to another thing that I wanted to kind of ask our panel is about the accessibility to these assistive technology and also the cost factors. And you touched on the richness and all that, Atif, but I still think that we do have people in the Western world who don't have access to these technologies, either in terms of affordability or in terms of knowing how to access it. In that sense, I'm going to bring in Bal and Mo first to give their experiences in terms of accessing some of these technologies and their experiences before I bring you and Portia back, Atif.
Yeah, sure.
Bal, over to you.
So yeah, you're absolutely right, Natty. There are so many people out there who can't afford to buy assistive technology. Some assistive technologies can go into hundreds of thousands of pounds. Assistive technology is not just IT technology either, but also like for physical impairments as well. And like buying a wheelchair costs £8,000 for your basic standard it just gets you from A to B kind of wheelchair. And yeah, I just think the cost and knowing how to use it as well. I remember at the start of lockdown in the UK, my mum's friends couldn't use Zoom, so we had to teach her over the phone, and it was a shame. She wanted to use it, but didn't know how to. So, over to you, Ma.
Yeah, definitely. I think all these products are so amazing because they definitely do help to some extent, but definitely the limiting factor for this are prices. So, for example, Jaws, which is, as I described earlier, the text-to-speech software, costs in the region of £1,000,
Sure.
and that is without having a laptop, and that is a software that enables me to use a laptop that otherwise I wouldn't be able to use, and that means doing uni work, all that stuff related to university, and I wouldn't be able to do that without that software, but you have to pay that price. And alongside that, really, is you're paying for a product, amazing though it is, that isn't entirely accessible with all software, and that's probably not on their not from their side, but because obviously programs need to be accessible themselves for this software to work with it, but there definitely is a limiting factor. So even though you have all these products and you're paying so much for them, they're not entirely accessible or work all the time.
Yeah, that's Yeah, if I bring you in, Atif, here, from your experiences working with students in Mauritius and other countries, but how I know there are certain products which are prohibitive in costs in terms of, but how do we go about meeting those challenges in terms of providing these AT?
Yeah, so I mean, I'm grateful you asked. So I suppose for DNA, you'll see our website. There's a whole bunch of free assistive technology that we put on our resources page. And I suppose if I think about the work in Mauritius, it was about challenging global poverty, local poverty in Mauritius. And we have no business talking about what assistive technology can change someone's life if we're not prepared to give it away for free at that moment. Because there isn't a DSA there isn't a Disabled Students Allowance, there isn't an Equalities Act, there isn't. So when you look at those things, you have to sort of think, how do we stay cognizant that the most disabling things in the world are tied to socioeconomics? And that is actually in the global south that we'll see some of the strongest impacts of those disabilities. And those are the spaces, and I touched on this earlier, saying those folks who probably need it the most, and that includes in the UK, those folks who need it the most may well be the people that access it the least. And then if I bring that to a UK context, what we can see is, look, mental health, it costs the UK economy 5.4 billion. It is a huge disabling dynamic. And then we think about hidden differences and hidden different disabilities. Could be neurodivergency ones, it could be muscular dystrophy, it could be, these have an impact on poverty and job access. And as a result, homelessness, street homelessness, as well as vulnerable sleeping. So what do I mean by that is it's very hard to access an access to work program if you don't have a job, and therefore you don't access the technology that you deserve and desperately need. It's very hard to access the DSA if you're not in your attainment support isn't reaching higher education. So there you don't access the very technology that we're largely talking about today. And so it's very hard to say, well, what do you say? Well, we're saying that folks who are going through that poverty are going to continue facing that impact. And so when we think about the disability, if I use cerebral palsy, for example, I might need to not think about cerebral palsy, but rather the impact on the two individuals. One is socially supported, emotionally supported at times, and one is homeless. And so that disability employment gap, I think about that stands at 36%. That's in the UK, and it can't be met in this lifetime, not at that rate. So we've got to figure out what role do these tools make, and how do we apply them best to those who need it most? And it really can't be to people just because they're in higher education or just because they're in, although I know it's life-changing, of course, but it's just not enough to apply that to higher education models and workplace ones. And in the global south, I suspect that's where we're going to see the symmetry.
Yeah, I totally agree. But I know we're rapidly running out of time, and we are beyond 7 o'clock. But it wouldn't be fair if I don't touch on a couple of things which are very close to my heart. So we're going to extend it for a couple of more minutes, and I'm going to ask each one of you to say, what is future? And from your perspective, from your opinion, if I ask you one thing that you'd see how AT is going to be in the future, what would be your answer? Atif, if you start, and then we'll go clockwise from Portia to Bal to Mo.
Yeah, I truly think the global south has been so motivated and moved by open source technology. I truly do. I think that it's a community-driven narrative. It's not perfect, but I really love the idea that we can utilize it more. And so I guess for me, it's about looking at the role of assistive technology, and I'm hopeful, very hopeful, in the role that it plays in poverty, and poverty, in particular poverty relief.
Okay, Portia.
Okay, assistive technology, it's got to be available to everybody that needs it, and it's got to be in a format that everybody can use, which is possibly impossible, but you can't have, say, features that are really good for one sector of the community that nobody else can use, for example. So it's got to consider human beings holistically as the complicated things that they are, You know, nobody is just a physical condition or an age or whatever. We're very complex beings as human beings, and I think assistive technology needs to reflect that.
Okay. Val?
I think the future is in IT and in app development. I think they need to get ask the whole sector, old to young, disabled to non-disabled, black people to white people, LGBT plus people to heterosexual people. Sorry, I can't get my teeth in now. We need to ask everybody to help create things that Portia just said. You can't do it sat in an office on your own because you're only using your own lived experience. You need to ask everybody. That's my opinion.
Thank you for that, Val.
Thank you. Sorry if we looked like we were giggling then, we weren't. It's Frida's dreaming next to me, most guide log, and she's woofeting in her sleep. So if you hear little woofets, it's just Frida.
All right. Okay. We've got several comments and questions from the audience. The first comment is about the social model and the way that it's explained, and there is a story that they've written in terms of explaining that, and it's interesting, and we will try and post that question and within our answers to the questions raised. The next comment is about the current pandemic and education is digital and accessible, and people want a view on it. And I think one of our answers and one of the presentations relates to that, and Val's example was very, very relevant to that. In that sense, yes, we have got a long way to go, but we have made some progress in that sense. And the next comment is about mental health issues and mental health being mentioned, and they're glad it's not deliberately overlooked or deliberately ignored in that sense. So there are a couple of more comments, and I would like to reassure everyone that this recording will be available and there will be captions in there so people can access it. And one of the things that I wanted to discuss, probably we are really running out of time and we wouldn't have it, is about Atif mentioned the medical model. As a person who's involved in clinical research, and I'd like to debate in terms of the medical model versus social model, and some of my colleagues would know me always speak about either it's quantitative research or qualitative research and which is better. And I've definitely gone to the other side in terms of looking at lived experiences and the social models, and that's very, very relevant and important in the current context. So I'd like to thank a big thank you to all of you, the panel. You've been a great panel, and your presentations and the answers have been fantastic. You've really shaped our understanding in terms of the amazing potential the assistive technology has and how it makes it's an inclusive and also the accessible world in that sense. So, and also a big thank you to the audience. I know we have not had time to answer and read out all your comments. It's very difficult to fit in everything within an hour. But we'll make sure that those comments are reflected when we compile this video and post it on our website. And if you've got any further questions to the panel, we are all really happy to answer those. Please send them to comms@staffs.ac.uk, and we will post that email address on that website too. And as I said earlier, the recording of this event will be available with captions, and look out for further conversations like this over this month. Thank you and good night.
Thank you everyone. Well done, actually. Thank you all.
Thank you.